Hey everyone, and welcome to another deep dive. Today we're going someplace, well, a little bit different. It's a corner of the medical world we don't talk about a lot, but it's important: mucosal melanoma.
Yeah, it's definitely one of those things that, most people haven't heard of it
Hmm.
until they have.
Exactly. And that's why we're doing a deep dive on it, right? To uncover those hidden health risks. And this one's tricky.
It is. It is. It's really interesting, actually, from a research perspective, a kind of case study in diagnosis.
Okay, so let's break it down. What is mucosal melanoma? I think most people, they hear melanoma and they think, okay, skin cancer, but
Right, right. And it's easy to make that leap, but
it's not that simple.
not quite. When we say mucosal melanoma, we're talking about cancer that affects the mucous membranes, those tissues inside the body, not the skin itself.
Okay, so for those of us who maybe didn't pay attention in anatomy class, remind us, what are mucous membranes? Where would we find those?
Oh, sure. Think of it like the lining inside your nose, your mouth. It's that soft, moist tissue, and it's there to protect all sorts of cavities and passageways.
Okay.
Nasal passages, sinuses, your mouth, of course,
Ro-
parts of the digestive system, even the reproductive system.
Wow, so we're not just talking about one specific location then. This could pop up in a lot of different places.
Yeah, and that's part of what makes it so tricky. And unlike skin melanoma, where we know, okay, UV exposure is a big risk factor,
Right.
we don't have that with mucosal melanoma.
So I can't blame my beach vacations for this one.
Not this time. Yeah. Honestly, the exact causes are still being researched, but
Yeah.
we can rule out UV. There's early evidence suggesting there might be a connection with smoking, especially for cases in the head and neck.
Okay.
But we need a lot more research to say anything for sure on that.
So no clear culprit yet. But knowing that it can develop all these different places and we don't know exactly why, that must make it really hard to catch early on, right?
You're absolutely right. Early diagnosis it's one of the biggest challenges. One of the main things is the symptoms are often really vague. You could easily mistake them for something totally minor.
Okay, can you give us some examples? Like, what kind of red flag should we be looking out for? What might we be missing?
Well, let's say you have a sore in your mouth and it just won't go away. You might just figure, oh, it's a dental thing, right?
Right.
But that could be oral mucosal melanoma. Or say you have sinusitis, that just won't clear up with the usual treatments. Easy to miss that it could be sinonasal melanoma.
I had a sinus infection last year, dragged on for weeks. Makes you think.
Exactly. And unfortunately, because the symptoms are often so vague, it means that by the time someone actually gets diagnosed, the cancer is often progressed.
So it's more advanced and harder to treat.
Exactly.
So we're talking about a rare cancer. It's hard to diagnose. It can be anywhere in the body.
And, it's worth mentioning, mucosal melanoma has a much lower survival rate than skin melanoma.
Really? How much lower are we talking?
5-year survival rate is only about 14% compared to 90% for skin melanoma.
Wow. That is a huge difference. Okay, so clearly this is something it's important to understand. Before we get into treatment, though, I think we need to maybe address the elephant in the room. I think some folks listening are probably like, okay, this is a lot to take in. Rare cancer, hard to diagnose, lower survival rates. Like,
Yeah, it's heavy stuff. It's understandable to feel overwhelmed.
right.
But, knowledge really is power.
Okay.
Understanding the challenges, that's the first step toward taking action.
I like that. So let's shift gears a little bit then and talk about treatment. What's the landscape look like for mucosal melanoma?
Well, usually the main treatment's going to be surgery.
Okay.
The goal is to get the whole tumor out.
Makes sense.
But, as we've been talking about, these tumors, they pop up in some tricky spots,
Right. It's not just about, like, can you get to it, but what's around it?
Exactly. You have to think about preserving those surrounding tissues, all those vital structures. We're often working in very, very delicate areas.
Yeah.
So depending on where the tumor is, you have to consider, how's this going to impact their ability to speak, swallow, even breathe?
So what happens if surgery's not an option? Like, it's too advanced or it's just in a really difficult spot? Yeah. What else can you do?
Well, that's when we start looking at chemotherapy, radiation therapy.
Okay.
Sometimes we use those before surgery, try to shrink the tumor. Sometimes it's after to make sure we've got everything.
Right.
And sometimes it's the main treatment if we can't operate.
So it's really about kind of tailoring it to the person and how advanced it is and all of that. Are there any new treatments coming out? I feel like cancer research, it's always moving so fast.
Oh, absolutely. There's always something new being researched. And the good news is We're seeing some really promising stuff with immunotherapy and targeted therapies.
Okay, what are those? Tell me more.
So immunotherapy, imagine training your immune system to like sniff out and destroy those melanoma cells. That's basically what we're doing. We're
Oh,
boosting your body's natural defenses to fight back.
that's amazing. It's like giving your own body superpowers.
It really is. And then there's targeted therapy. That's more like we're using a laser, basically, to go after a very specific thing in that cancer cell.
Mm.
It disrupts the growth, but it doesn't harm the healthy cells.
Hmm.
Very precise.
That's incredible. So it sounds like these new treatments, they offer a lot of hope, especially given those lower survival rates we were talking about earlier.
They do. They definitely do. And it really emphasizes why research is so important in this area.
Yeah.
The more we can figure out exactly how mucosal melanoma works,
Yeah.
the better our treatments are going to be. And hopefully that means a better outlook for patients too.
Knowledge is power.
Exactly. And this is where it gets really interesting from a research standpoint, actually. Because what we're learning about mucosal melanoma, it's helping us figure out how to target cancers based on their genetics,
Mm.
not just where they are in the body.
Oh, wow.
And a big deal. It's like personalized medicine. It's the future.
That's amazing. It's really incredible how much we're still learning just about how cancer works and how to fight it.
Oh, for sure. And even though the statistics for mucosal melanoma can seem kind of, daunting,
Right.
it's important to remember that everyone's different. Treatment is always advancing.
Hmm.
And early detection, take in a team approach, there's always hope.
It's so true. There's always hope. But hope's not a plan, right? What about our listeners? What can they actually do? If someone's listening to this thinking, okay, this is scary, but what can I do?
Honestly,
Yeah.
the biggest thing is just be proactive. See your doctor regularly, even if you feel fine.
It's easy to let those checkups slide,
It is, but those early checkups, that's key.
especially with this one.
Really important to catch it early.
Absolutely. And listen to your body. Pay attention to what it's telling you. If something feels off, if it's not going away, don't ignore it. Talk to your doctor. Don't just brush it off.
Right.
Even if you think you're being a hypochondriac.
Right. Nobody knows your body better than you do. And ask questions. You have every right.
Yeah.
The more you know, the better you can advocate for yourself.
Absolutely. Okay, so we've covered a lot about this rare cancer. Any last thoughts you want to leave our listeners with?
If even one person listening decides to schedule that doctor's appointment they've been putting off, or feels more comfortable speaking up about their health,
Yeah.
then to me, that's a win. That's what matters.
I love that. And you know what? It just strikes me that, mucosal melanoma, it's rare, but it really highlights something important about, all cancer research, early detection, all of that.
Oh, for sure.
Like we start digging into this one thing, seems kind of obscure, and it ends up being relevant to a much bigger picture.
Exactly. It's all connected. You make a breakthrough in one area, even a rare disease. Who knows what kind of impact that could have somewhere else?
It's like they say, right. The more you learn, the more you realize you don't know.
Right.
That's what makes this all so fascinating. So even though we're at the end of this deep dive, feels like the start of a much bigger conversation, right?
Absolutely.
Like being proactive about staying curious about your health.
Couldn't agree more. Curiosity is key. It can even save your life when you think about it.
Yeah.
Early detection is everything.
So well said. Thank you so much for joining us today. This was great.
My pleasure.
And to everyone listening, thanks for being here for another deep dive. Remember, knowledge is power. Even maybe especially when it comes to those more obscure corners of the medical world. Until next time, stay curious.